Well, welcome everybody. Uh, we're learning how to do Facebook Live here, slowly building up the capacity of the Health Equity Council. And one of the capacities that we have and that we're trying to continue to build is our ability to engage with community. And the community in general and the Health Equity Council have lost an important person, a powerful person in community engagement, in our friend and without being over dramatic, our loved one of Reina Luz Juarez, who was co-coordinator for the International District Healthy Communities Coalition, and also a and someone's going to call me right now. Perfect Facebook Live test. And a community school coordinator with just an amazing outreach and impact on the community. She passed suddenly yesterday. We don't know any details other than that. And we'd like to start this meeting with just a short moment of silence in honor of her and the great work that she does, and the big loss that it is going to be for us all. Thank you, everyone.
So we have a few, first I guess we could go around and introduce ourselves and who we are and to the public. This is our first live stream Facebook event. We are hybrid, so we are in person and online. And so anyone who is following or watching us on Facebook, we're taking this time because we would like to invite you to be part of the council, to be part of this health equity movement. We are providing tests in our lobby. So we need to give you our address so that you can come by, visit us, pick up test kits, COVID-19 test kits and packets that we have provided here, including PPE. This is for our community, this is for your schools, this is for your families. We invite you to show up, come introduce yourself and pick up tests. You're welcome to take tests for family. If you work in thank you, Diana. You're welcome to, if you work with the community or you're a teacher, you work in health, we're welcoming everybody to take as many kits as they need at this point. And we'll talk a little bit more about that. So we have that live. You're welcome to drive up. Okay, there's an echo. So I don't know how to fix that. Is it bad on the other end? Just testing. Okay. So yes, so we're inviting people to join us at the Health Equity Council. We're down here, and our address, which I don't know. Anna, can you share our address?
Yes, we are at 222 Adams Street, southeast. We are near the intersection of Central and Washington. And we are giving out COVID tests and masks and hand sanitizer tonight.
So you're welcome to come pick up test kits. If you work in a community organization, or you work with students, families, neighbors, we're welcoming everyone to come down and pick these pieces up to distribute to your friends, your family. And we just ask you to, want actually the community to know that we're here for you, and that, anything that we have that we can provide just to make life a little bit easier. We'd like to do that. So we have these COVID tests. They're self-home tests. They take 15 minutes. There's 2 tests in each kit. And you are welcome to take multiple kits for your family. And we ask that you do that and that you distribute these also to those around you, your neighbors, people that you work with. And so we're here, and we are here to support, all of our friends, families, community. Behind me is a large stack of PPE that you're welcome to take as well to your organizations or your home. And we can talk about that in a little while. So today, or this evening, we're going to make this an ongoing event. So I'm going to go ahead and just start off by introducing. So we'll be distributing till 7:30 this evening in person, but that doesn't mean that you can't come by tomorrow sometime in the afternoon or notify us if you would like to make arrangements to pick up boxes. So we'll be here this evening, and the reason we're doing this in the evening is so that if you work late or your family gets off, we want to be here after hours to kind of support all those people that are working. And so if you need to come by a different day, that's fine. You can go ahead and contact us at the Health Equity Council. And Anna, if you can share that information, maybe our phone number, you can contact myself. And so, yes, we want to be here. Our number here at the council is 505-246-1638. And you're welcome to call, leave a message, let us know. We do have limited staff here in the office, but we are still distributing, right? So if you wanted to pick up test kits for your place of business or one of the school, maybe for the sovereignty, you're welcome to call, let us know how many you need, and we can make arrangements for that. And this evening is so that you can just, drive by, pick up. But we want to thank you everyone that has joined us so far. And today we have a special guest. We're going to be talking about, well, I guess first let's introduce ourselves and who the Health Equity Council is. Back up. Let's talk about who the Health Equity Council is, what our mission is, and we can just introduce who we are as part of the council, if everybody is okay with that. Is that good to you? Okay. So I'll go ahead and start. My name is Carmela Roybal. I am a medical sociologist and public health specialist, and I work heavily in research and population health. I've been a part of the Equity Council for about 2 years, and part of the health movement for around 15 years. I'm happy to serve the community here. And I just want to thank everyone for joining us. Anna has placed our mission into the chat. And I want to pass it to Enrique, our executive director here at the Health Equity Council.
Yeah, and thank you, Dr. Roybal. Just the mission and vision don't show up on the Facebook Live. So if one of you want to mention that as we are letting folks know who we are, that would be awesome.
Okay. Is anyone from our team willing to share our mission, vision?
Go ahead and do that. As Enrique may be working with somebody, he's at the front door right now distributing COVID tests down here at the Health Equity Council, 222 Adams Street. The Health Equity Council, our vision here is creating a community that supports the ability of everyone to meet their full potential, so that every community member in Albuquerque and Bernalillo County has the ability to meet their full potential without bias. We strive to create that kind of community and improve health equity and quality of life through coalition building, health assessment and planning, and supporting community action. We promote, we advocate, and we achieve health equity for everyone in Bernalillo County. That's our mission here at the Health Council. My name is Anna Horner, and I'm here to support the leadership of Dr. Roybal and Enrique and all of the other partners and team members that we have with us here today. And I will pass it over to our guest speaker for today, Pelatia, to introduce herself.
Let's see if Pelatia, are you with us? I'm sure she'll be back on. It could be a connection issue as well. We have our vaccine team. So we're part of a community rebuild grant through the CDC and the New Mexico Health Alliance. And so we have a vaccine team that we've assembled. And so we have some of our team members here. Matt, could you introduce yourself?
Hello, thank you, Dr. Roybal. This is Matt Krosky again. I'm with the Department of Health and a member of the Health Council. thanks for doing this great event.
Thank you, Matt. And we have Ashley.
Good evening, everyone. My name is Ashley Ringwood, Health Promotion Specialist with New Mexico Department of Health, alongside with Matt. And I work closely with Bernalillo and Torrance County. And we're just a health promotion statewide program that focuses on health at the population level. And we're here to support the Bernalillo Health Council or Health Equity Council in any efforts moving forward to improve the quality of everybody's life.
Thank you, Ashley. And I want the public to also know that the health specialists that we have here, promotion specialists, Matt and Ashley, anyone that calls in or messages questions regarding the vaccine, getting the vaccine, questions regarding what's happening in the state, you are welcome to ask those questions. We have specialists on the line right now that could actually help us get through that and get through any of those questions. Is Pelatia as our guest able to introduce herself? Is it working now? We also have a special guest, Emil. Would you like to introduce yourself while we work through our technical difficulties?
Hi, good evening, everyone. Zamil Salhab, my pronouns are they, them, theirs. Community member, and I've really appreciated these meetings over the last few weeks, and for me it's been really helpful and impactful, and I've had the ability to just also hear all of the great sharing and the work that's happening as well. So thank you for having them, and thank you for having me in space.
Thank you so much for joining us, Emil. I really appreciate you coming and adding to the conversation. We've had some really great conversations, but they've been among ourselves, right? All of our teams, our internal teams. And by going live on Facebook, we want to be able to open this opportunity and these wonderful discussions to the public to hear and talk about. And we're very much about making change on the ground and affecting the people that are most affected and providing, without discriminating to families and communities in those hard places, where people are marginalized, and really kind of helping change that narrative. So I want to thank everyone for joining us. Is Pelatia able to?
Yes, can you hear me?
Yes, we can. Thank you, Pelatia. Thank you so much for joining us.
I'm so sorry about that. I'm bobbing and weaving over here, and so having a little bit of technical issues. So I appreciate you all and holding space for me. My name is Pelatia Trujillo. I am the Executive Director of Dope Services, and I am a Health Promotion Specialist / Overdose Prevention Coordinator at the Health Equity Council. It's nice to meet you all, and thank you so much for allowing me to be a part of this discussion.
Thank you, Pelatia. And really important, our initiative here with the vaccine team, the Health Equity Council, is being able to work with all of our communities and some of our most marginalized communities. And we really felt strongly about our outreach and our harm reduction team and the work that they're doing, to promote health. And so Pelatia is our special guest today, who's going to work with us and talk with us and have conversations around harm reduction and the outreach she does in the communities here in Albuquerque. And what's that like? And what are some of the solutions that we can provide, or we can come together, we can support in order to address the needs of our unhoused folks or our family that's out there and, needing vaccines and needing other types of assistance. What can we do as a community? What can we do as a health council to support these really important efforts? So Pelatia, I'm going to open it up to you to just talk about harm reduction, talk about what you see out there, talk about, it's really up to you, and then we can go from there.
Yeah, absolutely, Carmela. Thank you very much. So I think to start off, I think it's most important to really talk about what harm reduction is, because I don't think that it's always clear, especially when we're in community, about what's provided when we're talking about harm reduction. So generally, when we say the word harm reduction, usually what comes up is needle exchange, right? Talking about needle exchange because obviously we did that to reduce the harm that sharing needles was causing to individuals in our communities, right? Specifically here in New Mexico, we have really, and still have really high Hep C rates, and also think HIV was being transmitted as well through intravenous substance use. So that's initially how the harm reduction model kind of started. However, there's a whole different way to look at harm reduction now, especially when we're talking about public health, and I think that's where we open up the conversation here. Other things that you hear about when we're talking about harm reduction is also overdose prevention, right? Narcan or naloxone, which is ultimately a way for people to use more safely and overdose deaths, right? And so what you're using the Narcan for is actually to respond to overdose versus telling someone, hey, we need you to stop what you're doing so that you don't overdose, right? And so that's another thing that I think that we should highlight when we're talking about harm reduction is it's a more non-judgmental approach to the risks that we're taking on a day-to-day basis. And when I say non-judgmental, I don't necessarily just mean verbally, I mean systemically as well, right? It's a way to communicate with someone about the risks that they're currently taking, help them to come up with options that work for them in their situation, but also not try to stop the risky behavior that they're doing at that moment, right? And I think this is important, especially when we're talking about substances, because taking the substance away is not always the best way to take care of a person that is dealing with substance issues, right? And I think it can get real muddy, especially because people have different thoughts about, you know, how to support community members through this. But I love the idea of taking a different approach and really meeting somebody where they're at in that moment, right? So if I'm in this moment and I'm using substances, whatever reason that I'm using substances, whether it be coping or extreme cold or just partying, right? I recognize the reasons around why I'm using those substances. I have resources available to help me take steps to make better health decisions for myself, right? Because it's also important to promote and empower the individuals make healthy decisions for their own lives, right? And take steps to make their, to kind of achieve their ideal health, not the thoughts of others, right? Their ideal health. And so when we talk about harm reduction in a public health perspective, there's so many different risks that we take on a daily basis, especially when we're talking about COVID now, especially with COVID rates being so high and it's spreading so quickly, and people actually wanting to get back to living their normal lives, right? And so if that is happening and people are trying to go out and live these normal lives, how do we talk about reducing the harm of taking that risk, right? So one of the things we talk about is definitely masks. The Health Equity Council passing out PPE and testing supplies and all that good stuff is also a way of harm reduction, right? Putting on hand sanitizer is also harm reduction, right? It doesn't stop you from going out and using your hand, right? We're not telling you, hey, stop using your hand. No, we're telling you take more steps to keep your hands cleaner so that you don't, so that you have less risk of, you know, spreading this, right? And so that's what we need to talk about in a lot of different spaces when we talk about people and risk. Harm reduction is proven to work with people that use substances because it allows for the opportunity for people to be open about the risks that they're taking. And when you have to hide something or you feel stigmatized about something, it changes the resources that are available to you because it changes the people that you're willing to approach about those resources. It changes the communication that you have about what risks you're taking. And so I just kind of want to open up the conversation there and talk a little bit about how we as community members, especially in, you know, COVID times, how we can take more harm reduction approach to our daily lifestyles and going back into our daily activities.
Thank you, Palatia. Would you like to open it up to the group? For anybody?
Yes.
Okay.
Yeah, sorry about that. That would be great, Carmela. Thank you.
Thank you, Palatia. I know that rates at this time during the COVID-19 pandemic since 2020, the overdose rates have skyrocketed across. We do have data out showing the increase, right? Almost a 200% increase in overdose deaths during the COVID-19 pandemic. And we see this increased use. Harm reduction is, you know, you're in the forefront, you're boots on the ground, you're doing work out in the community. And during the pandemic and during dealing with COVID and your outreach efforts, you know, how can councils and how can teams and how can communities better support your work? I know some of the harm reduction efforts that you do are around Narcan distribution and training. Do you want to talk a little bit about that work, since we have a live audience and there may be people out there or community members that could really benefit from the trainings that your team provides around Narcan distribution, or some of the other efforts that?
Oh, yes, absolutely. So here at the Health Equity Council, we do have an overdose prevention program, which is, and it's called the HEC PDO program. And the way that works is we have training available for community members, open to community members, and that's all different types of community members that allows them to be trained on how to use Narcan, how Narcan works, and how to recognize and respond to overdose, right? And as community members, I think one of the things that we forget, a lot of times you'll ask people, do you think Narcan might be something that you need? And they'll say, no, right away, I don't use drugs, I don't use substances, right? But people are not Narcan themselves, right? And in a lot of open conversations, we have conversations about the statistics that we hear in regards to overdose. We are hearing about a lot of the overdose death rates, right? And because they are increasing, and it's important to highlight that. But what you don't hear from an outreach perspective is all the lives that were saved from the Narcan that was distributed to individuals. And this is data that we collect through our harm reduction. All harm reduction service providers collect this information, especially if they're DOH funded, where we ask people exactly what happened with the Narcan they were utilizing. And when we get that information back, also, I'm sorry, let me also link that with OSAT too, because the Health Equity Council is actually OSAT funded Narcan program. But even then, we're required to direct reviews on individuals that are out there using Narcan for their lives. And so when that does happen, we get that information, but that's not something that's always shown to the public, right? Not everyone sees those activities. A lot of that information.
Yeah, this is Anna. Sorry to interrupt you. There's a lot of background noise. It's kind of hard to hear.
Oh, I'm so.
From my end.
I apologize about that. I am on outreach, so let me just see if I can get this a little bit better reception here. So I apologize.
You're on outreach right now?
Yes, always. You like the party, right?
Right, so you're on outreach. So I'm excited that you're live doing outreach right now as we're talking about the importance of this. And your outreach is in southern New Mexico, or where are you coming from, Palatia?
Yes, so we are in southern New Mexico right now. Today we're actually in Meadow Lake a little bit later, but we actually visited quite a few people, so we're kind of hanging out here for a while to see if we can get everybody covered. But yes, we've extended services to our rural areas, because a lot of the rural areas, because a lot of the staffing has been redirected to deal with a lot of COVID stuff, a lot of the substance use stuff is kind of set to the side, which is totally understandable, but we want to kind of be there to support that a little bit. So we're doing a little bit more outreach to kind of make that happen. So I thank you all for holding space for me.
Latia, I have a question. I'm curious with the folks that you're doing outreach with since the pandemic has started. I know that you've continued to be out there distributing Narcan, distributing or offering needle exchange and other services to our substance use community. I'm curious, what kind of information you've come across in terms of people's experiences with COVID, what kind of questions people have, if they're able to access the PPE that might be needed, any sense of vaccine hesitancy or vaccine interest, or is that not something that you come across with the folks that you're working with?
No, it definitely is. And I think it's important that you bring that up too. As far as, vaccination, that's something that's an ongoing conversation around a lot of community members, right? There's still a lot of individuals in our community that feel uncomfortable with being vaccinated at this time. And a lot of that, what can be helpful in that situation is getting a lot more education as to the benefits of being vaccinated, but also having those uncomfortable conversations and understanding and hearing other people's perspectives as to why they're not getting vaccinated, right? Because I think we forget that side of it too, that there are individuals that have, reasons, depending on what they are, or depending on what they've experienced in their lives, that make them feel uncomfortable getting a vaccination, getting a shot, or, in some cases, getting anything from the government, right? And so there's a lot of ways to look at that. I've seen some people, come out and try to have these outright conversations, but it's always very like, well, no, you're wrong because you should get vaccinated. No, you have to get vaccinated. But there's not a really enough open-ended listening as to why community members feel so deeply and intensely about not getting vaccinated, right? And so I think it's important that we hear that too and open up to that, and try to have, supportive conversations around what those reasons are, right? Because I would never speak on anybody's individual perspective, right? But I also think that people have the right to their individual perspective. And so I think highlighting that and supporting that conversation is important in this movement too. I think another thing is that with overdose rates rising as well, so let me back up a little bit. So a little bit earlier, Carmela was talking about overdose and how the rates have risen and so on and so forth. Now, what a lot of people don't know about Narcan and naloxone is that Narcan and naloxone Narcan and naloxone are the same exact thing. Narcan only works for opioid overdose. So we're talking about opioid use specifically. And we're not just talking about the illicit opioids. We're talking about illicit and non-illicit, right? So we're talking about the prescriptions that you receive that are opioids and whatever you can purchase on the street, right? A lot of things, when we talk about overdose, immediately what comes up is black tar heroin or blues or whatever is available in the community that is illegal, right? But remember, we have other substances that are very legal that are prescribed that people are utilizing it as well, but they're overdosing on, right? And so I think that that's one thing that we recognize too when we're talking about Narcan. We're talking specifically about opioid overdose.
Right.
The biggest issue with opioid overdose is that it affects the respiratory system, so someone's breathing, right? And people that have overdosed in the past, their respiratory system has already been affected, so when they overdose again, or their risk for overdose is even higher every time they've overdosed, right? Not only that, but a person that has had COVID that has underlying respiratory issues and also overdose is even at higher risk of death, right? Because not only do they have the respiratory issues that are taking place from the opioid, but they have the underlying respiratory issues that they contracted during COVID, right? So not only is overdose rate high, overdose death.
Mr. Elbow last time, so.
So we have our.
Not really. I'm actually just came from off. I'm gonna go deliver.
Hello, everybody.
This is one of our team members coming right now to pick up COVID tests and take them out to the community and distribute. Do you want to introduce yourself?
Yes, I'm sorry. I'm Larry Novos. I'm work here at the Health Equity Council as a health promotion specialist. And yeah, I was just doing some drop offs to a couple of organizations now. So now that I have time, I'll just drop it in and say hi. We'll see you all.
Thank you, Larry. Thank you, Pelatia. That was like very helpful. Does anyone in our council here, any guests have any comments or questions?
Hi, Dr. Roybal. This is Ashley Pelletier. I just wanted to say thank you for that insight and your perspective of how to overlap harm reduction and COVID together. I think respecting, people's rights in using drugs or opioids or any substances, that's kind of the fundamental ground and principle that aims to protect human rights. And treating those who are using is really critical. And we just have to remember that treating everyone with compassion and dignity is the fundamental to harm reduction. And same thing in the pandemic. Everybody has their own rights, their own perspectives, and we need to treat everyone equally and continue to educate and bring those facts into play. No matter what someone's point of view is, we just continue as public health workers to educate and try to empower community to make that change moving forward.
Thank you so much for that comment, Ashley. Thank you. Critical, the work that yourself and Matt, I don't know if you have anything, Matt, you guys are in the front lines. You are out there organizing, getting people vaccinated, getting tests. You've been at the forefront of this, pandemic, working with the Department of Health in the trenches since all of this kind of broke out in 2020. And you just have so much insight working with our communities here, with the populations here. If you have anything for us and our guests, that would be awesome.
Well, goodness, you're asking for wisdom that my brain isn't having right now. But, more than anything, we just love to support the Health Equity Council and the way that you are able to connect different groups within community and have these great spaces for conversation. This is such a valuable time.
Thank you, Matt. And we really just commend all the work that you, Diana, Ashley, all our promotion specialists out there are doing. And thank you for being here this evening and, being able to contribute to this conversation and help us get through some of these questions. And just so key, Pelatia, that overlap that Ashley, how do we work with our, marginalized populations at this time, right? During COVID, during the pandemic, and at the same time thinking about harm reduction. And so this is just a very, this is really key and really powerful for us thinking forward during this time and how the Health Council, how do we help, how do we address? So I thank you so much for bringing all of this to the table. I'd like to invite Zamil or Virginia, if you have any comments or questions. Virginia, would you like to introduce yourself? We're kind of just going live on Facebook, so I apologize. But Virginia is our new, she's our intern, and she's going to play a really critical role here moving forward with some of our projects. So if you'd like to introduce yourself, that'd be wonderful. Thank you.
Okay, my name is Virginia Whitfield, and I'm doing my Master's of Public Health through New Mexico State University. And like Dr. Roybal said, I'm doing my internship with the Health Equity Council, and Dr. Roybal and I, she's helping, or we're doing some research right now, and I think it's going to be really great. It's the long-term effects of COVID, and so I think it'll be really interesting to learn more about that and to get involved with this research.
Thank you, Virginia. So we are also part of a long-term recovery group for the city of Albuquerque. So we are working on some fundamental research around the effects that it has on our gender population. So we're taking an intersectional look at the disparity in income, all the different inequalities, health disparities among populations, and particularly our populations here in the city of Albuquerque. So we're looking at building kind of a recovery toolkit. And so a little bit different approach. So taking a very intersectional and decolonial approach to understanding the disparities that are happening here right now to build a plan moving forward. So there's a little bit of work going behind that, and we're doing some research now, and we're going to be looking at mostly, some secondary data, but then also conducting most likely qualitative interviews with our different communities. But it's very focused on women's health, the impact on women, the gender effects that it has, the wealth gap, the gender wealth gap, and all of these different long-term. And so maybe in one of our future meetings, we can share some of our preliminary findings and also get some input from the community, like what that looks like and why we're doing something like that so different. So thank you, Virginia, for being here this evening and for joining our team. So for those that are just joining us or have recently joined us, we're the Health Equity Council. And tonight we are doing a live distribution drive of our COVID-19 home rapid tests. And so, yes, Matt, yes, Zamil, definitely. And I invite you, Zamil, we'll be having more conversations around the work that we're doing. And you're welcome to join us. We'd love input, especially from our community. So if anyone's interested, you're welcome to drive up. We'll be here till 7:30 handing out test kits. And you don't have to be sick or not feeling well to pick them up. You can pick them up and have them on your shelf and keep them near, just in case at some point that maybe you have family members coming to visit, maybe you have a neighbor that might need it. So we're inviting everybody to come by, pick up tests, take them home, take them to your place of business, your work, your school, your neighbor, your village, your pueblo. You're welcome to take some. And we also have PPE that we're handing out. So we'll be doing this on a weekly basis. We'll have guests coming in and talking about different areas of the pandemic and talking about vaccine equity, our COVID-19 projects, and really